Okay, we have a lot of question cards on narcotics. Uh, there's on the subscriber part of our website. We're doing a series on narcotics, and we're also in October doing a teleseminar that's free on narcotics. I think it's the one we're in from St. Louis, so that's October like the 19th. But we're going to go over some of these questions real quick in the time we have left. Um, First of all, when we're saying narcotics, what do we mean? Narcotics, we're talking about opiates, powerful pain relieving substances that are used as analgesics. We went over what analgesics are. Um, they're painkillers, they're pain meds. They come from plants manufactured in labs. They hit endorphins that occur naturally in your body. They hit neurotransmitters. They're very effective in the treatment of pain, especially severe pain. They're frequently used in treat acute pain, post-surgical pain, and they're used for severe pain like arachnoiditis, cancer, complex regional pain syndrome, chronic failed back syndrome. Uh, it's They're used in a lot of people for long-term treatment of non-cancer pain, and that's still controversial. The one of these questions is what are the controversies? Well, they derive from their controlled substance. They derive from the fact that a lot of doctors are afraid to use them because medical boards, DEA, everybody will get on them. There's a lot of people that think if you use opiates at all, if you prescribe them at all, you are uh, an addict. And a lot of this stems from addiction and abuse of the opioids. But let me tell you, under close medical supervision of someone who's well educated on how to use them, um, they're although there's a lot of controversy, simply put, opiates are very effective at reducing severe pain and keeping people under control when used right. They're usually used as a maintenance medicine, long-acting, and then a short-acting rescue. And we've already gone over that a little bit, and it's on the website as well if you want to learn more about that. Um, the website's mychronicpain.com. Yep. There are side effects. Drowsiness, confusion, nausea, constipation, urinary retention, difficulty breathing, sexual dysfunction, long-term sexual dysfunction due to reduced testosterone, low blood pressure, itching sensations. The side effects, there's actually something on the website that goes over that in detail, but the side effects are all something you can counter. Of course, you have to be careful with the drowsiness one especially. Um, as far as treating people with opiates, as long as you screen, and review, you're pretty safe. Urine drug screens, screening for aberrant behaviors, screening for people that potentially can abuse. People that have had addictions in other areas can use opioids if you screen them and watch them, observe them, and take care of them well, and maintain a good communication relationship. Of course, there's some addictionologists who disagree with me on that. Now, certain drugs interact negatively with opioids, and you have to be very careful with them, including those purchased over the counter. Nowadays, the Tylenol scare with all the different opioids that have Tylenol with them, and then you can buy all the Tylenol over the counter. That's a concern. Um, so there are a few questions here about addiction. We're going to go over addiction in the next one of these the next discussion group. So we're going to put that off for a little bit. I'm going to write down, make sure we go over in detail. All right. So some more questions real quick. Is it true the more opiates you take, the better they work? No. More does not equal better. It means more side effects. But actually, over time, it can desensitize you, and it can actually cause more problems. You can develop tolerance, but also there's evidence that raising dosages can actually cause more pain in some individuals. Let's see. Can anyone get addicted? Well, if you have there's legitimate reasons to be on pain medication. If you have addictive behaviors and you have a highly addictive nature, you can get addicted. There's also a thing called pseudo addiction, which means you are not getting treated just like you should be. Your long-acting drug may not be high enough, and you may be dosing yourself outside of the prescription. So that can be a problem as well. Let's see. Does everyone who takes narcotics get addicted? No. It largely depends on your own personal risk of addiction. Pain management screening for risk factors, a family history of addiction, a personal history of alcohol and drug abuse, certain psychiatric disorders. Those are all need to be considered, but the majority of the patients do not become addicted to prescription painkillers. I think the statistics I looked at recently were that in cancer it was almost non-existent, and in my practice, when I practiced in pain management, I had 28% of my patients get kicked out of the clinic for aberrant drug behavior, negative urine drug screens, positive urine drug screens. In other words, they didn't have the mess in their system that they were supposed to, or they had something in their system they weren't supposed to have, getting scripts from other doctors they weren't supposed to, and straight out addiction issues. And we referred them to someone else. Now, I had received quite a few patients from some other physicians whose practices were closed on them. That's probably why we had such a high rate. We had 1% of our cancer patients developed an addiction problem. 8% of our patients developed an addiction problem that were non-cancer. And when I say developed, we decided to treat them for that. It can be a problem. Some of the people that we also had some pseudo addiction issues, some people that didn't communicate to us well, but not everyone at all gets addicted. In fact, in pain management clinics that are run pretty well, it's not that often seen. But we do have to make lots of referrals. I mean, 8% of the population is a pretty big population. And then when we had the large kick-out number, a lot of those people came from practices that were not following the normal standards. So there are no long-term consequences. Yes, there are long-term consequences. Your endocrine system can have your hormones change to testosterone, your libido can, and your risk of osteoporosis can all go up. There are a lot more short-term side effects, and we've already mentioned addiction. Should you avoid opiate painkillers altogether? No. If you have a legitimate reason and legitimate pain and something that opiates can help, and there's nothing else that can help, or if it helps a great deal, if it improves your disability, if it gets your functioning, if it relieves your pain, gets you back on the road to recovering who you are, it's helpful. And I'm talking about chronic pain now, not acute injury. Acute injuries, it's used with very little problems there. The majority of people that use prescription pain medicines are short-term treatment. The long-term patients, a lot of them can't function without some sort of opiate appropriately. So I think we got all the questions answered. That was 9 cards. I think we covered them all. And we're going to go over narcotics and addiction in tomorrow's seminar with the assistance of 2 other physicians in a discussion group. So I hope you can be there. And for those of you that can't, I hope I answered the question for you. Take care.